Senator Payman, you have the call, and then Senator Urquhart.
Thank you, Chair. I've just got some questions around the DNA screen program. I'll wait for the officials. So the DNA screen program at Monash University has now tested 10,000 for medically actionable high genetic risk factors for cancer and heart disease, finding hundreds of high-risk people who did not previously know about their genetic risk and can take action to prevent disease or catch and treat it early. The recent Senate inquiry into rare cancers recommended that a total legislative ban be introduced on the use of genetic results in life insurance, which is underwriting as a matter of priority. This has been shown to be the biggest barrier to the uptake of DNA screening in Australia. Do we have any updates on what progress has been made towards the introduction of a legislation?
That's a matter for the Treasury portfolio. So obviously we have an interest from health. We've been asked previously at these hearings about the health benefits of having an not having that data allowed for insurance, but it's actually a matter for Treasury to follow through that through their legislation.
Okay, I'll put that question to them. In terms of the serious barrier to public uptake of DNA screening now being removed, what progress is being made towards investing in DNA screening for adult disease prevention?
So, Senator, as you're aware, the work that's been undertaken has been very much in the context of a research trial, and there is considerable work still to be done. For the government to consider the introduction of any form of screening program, it really needs to adhere to the population screening framework that we have in place, which means we really need to demonstrate really strong evidence based on safety, that it can be reproduced, the accuracy of the screening test. We also need to make sure that whatever people are screened for, that then there is actually efficacious treatment available to them. And we need to make sure that there's no harm done in the screening program. At this point in time, we would suggest that the excellent work that has been undertaken is very much still in research stages, and the research needs to continue for government to be able to consider it as a screening program that could possibly be introduced.
Is there a time frame for the research or any particular milestones?
So my understanding is the researchers have a proposal that they have put to government which would require significant funding.
No worries. Thank you very much. Thank you, Chair.
Thank you, Senator Payman. Senator Urquhart.
Thanks very much. My question's around the urgent care clinics. So if I can have those officials back to the table.